My name's Karl Krieger. I'm the Vice Chairman of the Department of Cardiothoracic Surgery. I'm also Director of the training program. I do adult cardiac surgery. That's primarily bypass surgery, valvular surgery. I also specialize in operating on patients over the age of 80. We have one of the largest series of 80-year-olds and 90-year-olds in the country, and we were one of the first centers to focus our interest in that particular group. I grew up working on a cattle ranch in Montana, and when I was in college, my father had a heart attack and had one of the first bypass operations that was done on the West Coast. He lived from that original bypass operation a total of 30 years. And so I saw during that time what the operation had done for him and for my family, and particularly my mother, and realized that this was an exciting new area of medicine that I was interested in getting into, because I thought it was something worthy of a lifetime of work. New-York-Presbyterian Hospital, we in many ways have the best of almost everything. And over the years I've been offered jobs at many other places, and the reason I haven't left is because I feel that we can provide the best cardiovascular medical care in the United States here. We have world's experts in almost every area of medicine, so at my fingertips I can always get a consultant that can help me with a difficult problem. In addition, we've developed a very strong team approach where everyone on the team is important and contributes to a patient's care. We want every patient that leaves this hospital to go home and say, well, I'm not excited I had to have heart surgery, but that was a great experience. One of the things I enjoy doing is getting to know the patients. As I said, I specialize a lot in elderly patients. And I think one of the reasons I like working with that group is that I admire them. They are brave. I think that it takes a lot for an 80-year-old or an 85-year-old to come to a big city hospital and be willing to have someone like me open their chest, put them on a heart-lung machine, operate on their heart. And so I admire their willingness to undergo that type of surgery. And so I think part of my job is to answer their questions, to let them get to know me and the team of people that are going to be taking care of them. I try to increase their comfort level by being honest with them about what the risks and the complications, and I try to be very straightforward with them. And I think in doing so, it makes them more comfortable about what they're getting into. At the end of the day, if you said, what's the most gratifying part of my job? After working all day in the operating room, I come back up and my mail is set out in my office, and there's always 2 or 3 letters from patients that I have operated on, in the last 10 or 20 years. And because I've been operating a long time, I get lots of those letters, and it's very gratifying.